Hello, I'm Dr. Rajeev Kurapati. I'm a hospitalist. I'm a physician based in United States. I work as a hospitalist in a large healthcare system in the Cincinnati area. I'm also trained in integrative medicine. I did a fellowship from the University of Arizona. In this short video, I would like to explain the fundamental difference between what we call as a Western medicine and holistic medicine of Ayurveda. Western medicine is based on what we call quantification because it relies heavily on measurable data to diagnose and treat diseases. This approach involves use of standardized tests to assess the body's structure and function, structural components and the individual functions, leading to evidence-based interventions. So quantification, standardization, are the hallmarks of Western medicine. But when I say quantification, use of metrics, use of mathematics and statistical data to arrive at their conclusions and formulate a treatment plan. Whereas Ayurveda is not focused on quantification, but rather on the qualitative aspects of health. It emphasizes balance and harmony of the body system. When we talk about balance and harmony, it's very difficult to quantify it and also standardize it because it changes from individual to individual, from geographical region to region, from season to season, from age to age, and so from gender to gender, and so on. So Ayurveda considers individuals' unique constitution called Prakriti, the state of doshas called Vata, Pitta, and Kapha, and the interplay between them and with the body, mind, and the spirit. So this concept makes it very difficult to quantify it. This is one of the very fundamental differences between Western medicine and a holistic Ayurvedic paradigm. You see, Western medicine sees the body, literally sees through the body from a certain lens, whereas Ayurveda looks at the body through a different lens. So trying to superimpose these concepts of Vata, Pitta, Kapha, and other approaches of Ayurveda and trying to superimpose on the Western medicine, trying to translate them becomes a challenging task. However, we can learn certain things from Ayurveda. No system of medicine is complete, whether it's Ayurveda, Western medicine, or what have you, because human biology is so complex and it is so elusive. Because the moment you discover something, you try to find a method to observe a human biology, you are automatically losing some other aspect of our biology. For example, by quantifying, you lose personalized approach. When you standardize across populations and try to apply it to the individual, it becomes a difficult task. At the same time, if you don't quantify it, it becomes very difficult to standardize it. You see this paradox of finding a balance between quantitative approach and balance and qualitative approach and personalized medicine. So integrating these two should be a nuanced concept. It involves education, it involves balance. This is what we call the art of medicine. We have the science of medicine, we have the art of medicine. So it's always challenging, at the same time exciting, because that involves the human touch, that involves the art of medicine to actually deal with the complete spectrum of health and disease. So Ayurveda has a very important role in health and diseases through its individualistic approach, whereas Western medicine, through its quantitative standardized approach, has its own unique advantages. I hope you understood a little bit of the differences and where they can converge and where they diverge, where the Western medicine and the Ayurveda converge and where they actually diverge. Because if we don't understand the fundamental differences and where it is difficult to integrate and where there is some opportunity of integration, we will be losing the benefits of Ayurveda.